The infant mortality rate in the U.S. rose for the first time in decades. This is all according to a CDC report released just yesterday. Infant mortality in the U.S. has generally been trending downward since 1995. Health experts say that any increase is certainly cause for concern.
This is so heartbreaking. Yeah. So we brought in our 9 health expert, Dr. Pyle Coley, to talk about this. So can you highlight what has been most concerning about the trends with infant mortality?
Well, you know, as you talk about, infant mortality really reflects the health of the country and how well we're taking care of our moms, how well we're taking care of our babies, and how well we're doing. And what's most concerning here in the U.S., of course, as we just said, it's gone up for the first time in 20 years. It shouldn't be going up. It should be going down. Even if it's flat, that's a concerning signal. But second, and more importantly, the U.S. does worse than other developed countries. So there's something about our country that's putting us way behind from our peers in Europe and other parts of the world.
What are some of the causes that we're looking at?
You know, it's really hard to tell, but especially in the last few years, and this happened in 2022, we think one of the biggest drivers is maternal health. If mom is not healthy, baby cannot be healthy, and we're seeing more and more high-risk moms getting pregnant. So we think that that's a big problem, especially if moms don't have access to care and such. The second is the COVID pandemic. We think that that's had an impact both on mom's health, because we know a lot of pregnant moms got admitted to the intensive care unit and such when they were pregnant, but even on babies, because we know that both COVID and RSV can be a cause of SIDS, sudden infant death syndrome, and that seems to have gone up as well over the past few years. And then lastly, I would say the fact that we've had changes in our reproductive rights. So in Texas, they saw that when they banned abortion, they actually saw an increase in infant mortality, which was really disheartening.
So this is from the ages of like being born to one year, right? You kind of touched on this in the beginning, but why is the U.S. falling behind other countries?
You know, so I think our moms are a little bit older, and a lot of scientists are saying that perhaps the moms that are getting pregnant are not as healthy as they ought to be. So we have one of the highest rates of obesity, kidney disease, diabetes, metabolic syndrome, a lot of the unhealthy conditions that can happen that can lead to adverse pregnancy outcomes. The system is not doing a good job plugging in our moms to prenatal care. So we're not getting regular access to prenatal visits, prenatal vitamins, to folic acid, to a lot of the other things that can improve pregnancy outcomes. And then this whole phenomenon of IVF, in vitro fertilization, has also changed the landscape of infant mortality, because even though, of course, we want our moms to get pregnant, have families, and have babies, if you're an unhealthier mom getting pregnant, it's potentially more likely to lead to adverse pregnancy outcomes and possibly infant mortality.
Now, the study also touched on something interesting regarding racial disparities in infant mortality. Can you talk about that?
This was really disheartening, and this sort of points to the fact that this is a systems level issue. But Black babies have the highest rate of infant mortality. It's gone up for everyone, all the races, but Black really sort of disproportionately so. We're also seeing it in American Indians as well. So I feel like this is really a wake-up call that, number one, there's a disconnect between getting moms the right care, and number two, being one of the most developed countries, why are we lagging behind the rest of the world? So this trend, for the first time in 20 years, to me, really raises alarm that we have to do something different. We have to do something better. Absolutely. A big part of that, I think, is also education. Education for moms, or, you know, future moms. If you're thinking about getting pregnant, really thinking about how you can meet with cardiologist, your obstetrician, your
Take
generalist.
Care of yourself and get ready.
Yes, get your body in good shape so that you can carry that pregnancy and really protect yourself against some of those infectious diseases like RSV and COVID.
I was talking about this yesterday. I was just saying, I feel like you were so spot on about the education part, right? Like, you have to be your advocate. You have to be educated about it, because it seems like a lot of women will research strollers and cribs like crazy, but then they don't do the education part on the other side. And that part is also really important.
It's such a good point. You know, we sort of start focusing on the nursery and the baby's room and all that stuff. We need to focus on our body, because that's what's going to give our baby the most health. And then, of course, that first year of life, making sure the baby gets vaccinated, making sure you do everything you can to protect your child.
One step at a time, of course. All right, Dr. Coley, important conversation. Thank you for coming in. We appreciate it.
Thank you. You can find all of Dr. Coley's appearances on 9news.com/Dr. Coley.